I'm Kristen Vengler, and our mission with this podcast is to help you and the people who love you through the shock of diagnosis and treatment.
I'm Eva Shea, and the incredible woman whose story you're about to hear is a nurse practitioner in San Francisco who has dedicated her life to caring for patients more vulnerable than you can imagine.
Her name is Natasha. This is a story about what happens when you have breast cancer, told in real time. Hey, Natasha, it's so good to see you.
Hey, you too.
Hey. So I think last time we talked was before you actually got to meet your oncologist. You had, I think because you're a nurse and because of your experience with all of this, you had kind of an idea where everything was going, but you are now a patient.
I am a patient.
Did they like your treatment plan that you gave them?
Well, they had a couple of changes they wanted to make. So I went along with them.
Yeah, so I want to hear about the oncology visit. I don't know which I want to hear first, the oncology visit or how you're feeling being a patient.
You know, it's been a really busy few weeks since we last spoke. The oncology visit was actually very reassuring. I loved the oncologist that I'm with. And it was very strange. She had a fellow with her. And for those who may not know, a fellow is somebody who's decided to specialize in oncology, and it's their very, very last year of training. So they take a pretty active role in treatment. And the fellow was actually somebody that I've worked with a lot. So it's one of those weird kind of crossovers of my life at this point. But also, I really like her. And it was two incredible women. I think maybe I had mentioned last time that I'd been originally scheduled to meet with a male oncologist. And I didn't have a big issue with that because obviously he's trained and experienced and educated, but it actually got changed because I wanted an oncologist who specializes in HER2 positive.
Right.
And this is what Dr. Chen does. And she was just so lovely. And the fellow was so lovely. And there was a way of sort of being a nurse practitioner going into this and knowing them that it really felt like a conversation. What we all aim for in the healthcare world is the sort of shared decision making. And it really felt like I had a say in what my treatment would be. I don't know if I had mentioned that I was sort of being set up for a clinical trial that at the time I was very excited about. After I met with Dr. Chen, she explained some of the potential downside of the clinical trial. And within a couple of minutes of listening to her, I was like, no, thank you. And she's like, great, that's exactly what I hoped you would say, but it was your decision to make.
Yeah.
And maybe we can talk at a later time about the differences in the actual treatment plan that they put me on. But there was some quite big changes, which I was happy about.
Mm-hmm.
And just very positive about sort of my prognosis. And it was a very upbeat appointment, which made me feel really good.
It was probably unexpected too. Whenever you hear I'm going to see my oncologist to find out about my cancer treatment plan, like there's no part of that sentence where you're like, oh, I'm going to come out of there feeling awesome. Right.
Right. And I mean, maybe it's partly, she stressed that being a 2A, she's like, this is a really good prognosis. It's going to be a long year. The treatment is still absolutely looking like a 12-month treatment, but we really expect a really good response to the 6 cycles of chemo. And the biggest change was they switched me to chemo every 3 weeks rather than every week, which just feels a lot more manageable.
Sure.
So what did you think the treatment plan was going to look like? And then what did it actually look like?
So the clinical trial had me with chemo every week for 12 weeks. And then, the dreaded chemo that gets referred to as AC is actually not indicated in HER2 positive patients, but that was part of the clinical trial. So Dr. Chen was just like, no, the best news is you don't have to do those 2 months of AC chemo, which shortened the chemo time. But that's the one I was dreading just from sort of reading some of the support groups. It's like, that's what seems to really knock the stuffing out of people. So I was pretty happy about that.
They call that one the Red Devil for a reason. So I remember when we talked, there's a question as to whether you even have to have surgery, right? Based on how the chemo is, how effective it is, right?
Yeah, so that's still a question. One of the things I was giving up by not having the clinical trial was the regular MRIs. And I brought that up in my appointment. And what was interesting was that she said, because the lymph node under my arm is so, and we say palpable, like it's so you can feel it, like it feels like an almond stuck under my arm. She said, we can kind of monitor it from how that lymph node shrinks with treatment. But they were so amenable. She's like, if you want a mid-treatment MRI, we're happy to do it. This is great.
Yeah, that's fantastic.
So one of the other great things that came out of the meeting is that everything's ready for me to start tomorrow. And I thought I may have to wait a few more weeks just because I know that UCSF gets so busy. But today is like a big scramble to get all my medications ready. And I had my port placed yesterday. So everything's happening really quickly.
What meds do you have to take today and what's for tomorrow?
So today they have me taking the steroids, so dexamethasone, also known as Decadron. So I take that tonight, which will be interesting because they basically said you also will have a hard time sleeping because it's a steroid. So here's something to help you sleep. And then tomorrow, a whole slew of meds. I can't even remember what they all are, but mostly focusing on nausea. And they want their patients to be very proactive. She's like, don't wait until you have the nausea, just take them. So, starting with ondansetron, the Zofran that everybody knows, and then, working the way down with some lorazepam, some Ativan, and then some compazine and, various other medications.
Have you thought about the logistics of tomorrow and like, what is that going to look like?
Yeah. So one of the things that I did change my mind about, which surprised me, but it was sort of supported by the oncology team, is I'm actually going to go ahead with the cold caps, not with the penguin caps, but with something called Digni caps that I think is maybe supposed to be a little bit better. And my understanding is it looks like one of those old fashioned hairdresser things that our grandparents stuck their heads under.
Like a dryer?
Yeah.
So excited to see pictures.
Yeah. And it was really sweet. Like it's all out of pocket and it was pretty expensive. And I wasn't sure it was really worth it for 5 or 6 months, but my dad offered to pay for it. My dad's in England and he's like, oh, I'm looking at a picture of you and your hair's so nice. And it feels like a very dad thing to do. So he offered to pay for it. But I think one of the reasons I decided that was that they said it doesn't happen very often, but for some women, the hair never comes back. So that was more what triggered it for me rather than hair loss for 4 or 5 months. That wasn't a big concern for me because there are great wigs, there are super cute caps, but the thought of it never coming back was a little disturbing.
Sure.
What's your dad's name? Can you tell me?
Yeah, Neil Curry. Yeah.
This episode sponsored by Natasha's dad. Thank you, Neil.
Thank you, Neil. So yeah, the logistics of tomorrow get complicated because with doing the cold caps, it means the appointment's much longer. I think I'm anticipating like a 6 or 7 hour appointment. I think tomorrow is a little easier because I don't need to do labs. I've had them done already for my port placement. So I don't have to go in until about 10:30. We were just chatting before about, the difference between San Francisco, San Diego, and Texas. Like I don't have a car in San Francisco. So logistics are a little challenging. They do want somebody to bring me home, partly because some of the medications can make me a bit drowsy. But I think in the morning I'm planning on just taking a ride share in.
Have you heard about this Uber thing? I hear that's from San Francisco.
Well, I didn't want to give them a plug. That's why I said ride share.
I just started watching the new show on Showtime.
I just downloaded it last night. So
good.
Yeah.
Very entertaining.
Yeah. And then, I think the plan is just sort of to come home and see how things go. I feel like, I really kicked into action mode in the past 3 or 4 days. Like I've got popsicles in the freezer in case my mouth gets sore and just sort of walking back from the pharmacy just a few minutes ago with it feels like half a pharmacy worth of meds in my bag. I realize it feels like I'm going on a journey. Like it's that kind of planning as if I'm like going on a big trip through Europe. And, it is a journey actually starting tomorrow. I felt kind of very sort of metaphorical with that whole idea. It's like, oh, let's not forget this and let's not forget that. And I'm sure I've forgotten something, but
you'll be at your house, right?
I will
You won't be on another continent.
Right.
And you'll know where to go to get it.
Yeah.
If you need, and lean on people. I'm being a mom right now, but let your friends bring them.
Yeah. Yeah. No, one of the great pieces of advice I had this morning. So I had what they call the chemo teach, which is when, you meet with a nurse and he or she goes over a lot of what to expect. And I've actually done chemo teaches. So we were able to really cut it down to the nuts and bolts, which was great for me because I I do have to keep reminding myself that I'm a patient, not running the show. Well, I'm running my show, but not their show. And the couple of things that I've heard from the nurses is like hydration and exercise are the two things that are going to get me through this.
Absolutely.
And they had such a great idea. She's like, I want you to walk 30 minutes a day. And she had this great idea. She's like, if you've got friends, basically pick a day for each of them, have them call you, and they get you out of bed for your walk, but they talk to you for the half an hour that you're walking. That I thought was a really lovely idea.
I love that.
Yeah.
And you could even break it down to 10 minutes 3 times a day if you want to walk down your stairs down to the corner and come back.
Mm-hmm. Yeah. If I'm worried about anything, that's my big concern. Like hitting my bed and staying there for days on end is like my go-to for anxiety. Almost anything. When I came back from having my port placed yesterday, I was home by about 3:30 and I just went to bed until the cat woke me up at 2 a.m. But yeah, so I really need to keep an eye on myself for not just spending the next 4.5 months in bed.
We can have some conversations because I had the same propensity.
Well, just hearing that exercise is the best thing for fatigue, I hear it and it sounds like a really hard recipe.
But it's the best thing that you can do. The more that I'm hearing, and it's for every stage that you're going through, and it's so good for your brain. It gets you out of your head too.
And the one thing the nurse reminded me this morning is as the blood counts drop inevitably because of the chemo, exercise can actually help bring your blood counts up too.
If you have someone who does body work, treat yourself to keep everything moving.
Yeah.
I keep giving you tips. We'll do that afterwards. I'm sorry.
No, I'm writing these all down. No, it's great.
I love that idea about a friend getting you up and out of bed.
Yeah, I thought that was great. Yeah. I mean, San Francisco is the city of people who flake. So it's, it would be very easy to be the person who has tons of commitments and then blows them all off last minute.
Culturally like that, it's okay to just not show up at the last minute?
You can text 5 minutes before with some excuse and it's become acceptable. It's weird. Yeah.
Wow. Okay. I have to ask, is that post-COVID or during COVID or was it like that before?
The whole time.
Always.
Yeah.
Tell me about the port placement yesterday.
It's something that patients can decide. So you either can have a peripheral IV, so the one most of us are used to, where they stick a needle in your arm and then they take it out at the end. Because my treatment's going to be in total a year, the chemo for 4 months, and then I'll be on Herceptin every 3 weeks to round out the year. It's a kind of more permanent but removable thing that goes in your chest area and then takes a little catheter down into your bloodstream. And it was a very interesting procedure. So I have 2 ways I look at this whole process. Like I look at it as a patient, but I'm also looking at it as an oncology nurse practitioner. It's like, this is kind of fascinating at the same time. So yesterday was one of those fascinating times because the machines that they had in the room where they placed my port was unbelievable. There was multi-million dollars worth of machinery in there. And it was not full sedation. It was a very odd kind of twilight. Like I was definitely awake and I could feel them sort of stuffing catheters through my chest. And it was a very odd feeling. And then, a lot of pain last night, which came as a bit of a surprise. They said it would ache, but nobody really told me that I wouldn't be able to sleep much. And it may have been the position. I'm a front sleeper, so I'm trying to sleep on my front with this port. And it was just, I was up a lot of the night and actually taking pain medicine like almost every 4 or 5 hours. This morning it feels much better, but it's pretty bruised. It's a strange thought and feeling that tomorrow they're actually going to what they call access the port. They're going to stick a needle in this. And right now it looks like a bruised mess.
Does a surgeon do this work to put it in?
No, it's actually interventional radiology. And they were funny and it was a great experience. It was just, a little trippy to feel something going through your vessels. I'd never felt that before.
That's so interesting because mine was vascular surgery. And it's very weird. It's I guess it just depends.
Mm-hmm. And did you bruise pretty badly after yours?
I did.
Yeah, it was interesting when they were discharging me from radiology yesterday. They said, "Oh, are you going for chemo now?" It's like, wow, they would really access it right now? That feels brutal. But happily, I could say no.
But 24 hours later, you feel like it's better enough that tomorrow it will be okay for them to poke it?
I don't want to look when they're poking it tomorrow. And I can look at most gruesome things, but no, it's like I think although it will be accessed for 6 or 7 hours tomorrow, so I guess I'll look at a certain point. But
How long is the Taxol, right?
no, so I'm not
Okay.
getting Taxol. I'm getting Taxotere, Carboplatin, Herceptin, and Perjeta. So the last two are the specifics for the HER2 positives. Did you get Taxol?
Mine was Taxol.
Yeah.
Mhm. It was AC for 8 weeks, and then it was Taxol for 12. And I guess that's the question is like, how long is the infusion since it's every 3 weeks that you're getting it?
So they've told me to expect 6 or 7 hours at least.
So interesting.
It's so interesting. And it must be very frustrating for other people to be hearing how different the regimens can be for two women who have essentially the same, well, we have a couple of differences, but it's all breast cancer. And, how do you know that you're on the right regimen? I think it's, the fact that they did your AC first and they're telling me I don't need AC. And even if I was going to have AC, it would be after and I'm not even getting Taxol, I'm getting Taxotere. It's like, you think there's a cookbook for this, and yet, there's like some people put extra salt and pepper.
It's true. It's true. Well, and my staging is a lot different too.
Mm-hmm. But, they've told me to bring lunch. And, like a lot of people during COVID, I started knitting. So I'm knitting. That's my plan for tomorrow, which may be hampered by the cold mittens, which was interesting. I actually brought that up. I think my biggest fear through all of this is like persistent neuropathy. So that sort of nerve damage. And we don't really know why. It can be pretty permanent for some people. So just sort of talking about preventing that. And the nurses in the infusion center that I talked with this morning said there's really not that much evidence that the mittens and socks do very much. But I'm willing to do anything to try and prevent that. But she did say, I thought it was good advice. She's like, don't torture yourself with this. If you've got a cold thing on your head and a cold thing on your feet and a cold thing on your hands and it's just miserable, stop it.
Yeah.
What's your backup plan for if you can't knit? Do you have something to read or watch?
Yeah, no, I have a nice iPad. Maybe I'll watch that Uber movie.
I need to get a San Franciscan's take on it.
Having the access that you do to, the nurses and all of that, they were insistent. They're like, you have to put it on 15 minutes beforehand. You have to do it for the full hour and do it for 15 minutes after. That's why I got 2 sets of everything, right? Mm-hmm. Of those 4 appendages, both hands and both feet, 3 of the 4 are affected on a daily basis. My right hand is not, but I kind of blew it off sometimes. If I wanted to be on my phone, I'd like put them on for a half an hour and then I'd be like, oh, right? Because I was bored and it wasn't affecting me right at that moment. And now I wish I would have taken it a lot more seriously. And we talked about it on the podcast. And Eva and I have had the conversation about shit they don't tell you. Like I thought that the nerve damage was going to be during the treatment and it all happened afterwards. And so I'm not trying to scare you, but I'm happy that you're taking that piece seriously.
Mm-hmm. That's the problem of, working in palliative care. I see a lot of people where, their quality of life has been quite significantly impacted by the treatment, not by the disease. As peppy and positive as my oncologist was last week, it's like, this is not an insignificant treatment. And it's very odd sitting here today feeling perfectly fine, despite having walked around with cancer for who knows how long. I have no idea how long I may have had this, knowing that I'm not going to be fine in 10 days' time. It feels strange to harm oneself with the goal of good health.
I completely empathize with that because I remember thinking, I feel great. I feel great. It's hard though.
There's a little bit of a pattern that I've heard now that I've listened to 2 of you talk through this. And one that's a little troubling to me as someone who hasn't gone through it. Kristen was forced to make a lot of her own decisions in areas where it seemed to me like those were not decisions you'd have the information or the background to make on your own. Like, you want to have radiation? I don't know. See what you think.
Yeah.
And it's something that you said made me think that that's happening a little bit already to you, that they're saying, well, you can make this decision on your, like getting a port.
Yeah. And it's one of the things I've been shocked by going through this is, I've worked in the oncology world for 15 plus years. I know what a port is. I know the pros and cons. Like I've been very happy with the sort of joint decision making because I have opinions about how I want my treatment to go. And I realize when I talk to my parents, I go, I'm having a port placed. My dad's no idea what that means. And when I sent pictures this morning of my, beautifully bruised chest, and they're just like, ow, did you really have to have that? Yeah. There are a lot of decisions. And I think, at UCSF, we're very lucky because we have nurse navigators. And I don't know if that's a thing that every hospital has, but it's sort of your best friend who's going to talk you through these things. So anybody out there listening, if your hospital offers a nurse navigator, absolutely say yes.
Fully agree. That was one of the things that Dr. Pacella was saying, that behind the scenes, that's the magician that gets all of the appointments scheduled, that helps you navigate literally the whole process to be sure you have everything in place, because there's so much emotion,
Yeah.
and I think that part of what can get lost in this podcast is that we're talking about this in a very, there's emotion, but it's pragmatic. We're giving information. And as I sit and I look at you, I can see that you're frightened
Yeah.
because you know what you're about to go through. And I'm about to cry right now because I know what you're about to go through. And I just want to hug you, and I'm not trying to make you feel badly. And it's easy to lose sight, especially with what you do, that you're a human and you're going through this and you're feeling it.
Yeah. No, there was definitely when I was waiting in the waiting room yesterday to get my port placed. One of my best friends is a therapist, which is actually really helpful because I get free therapy.
I love it.
And I can also just have 2 or 3 minutes rather than the whole hour. That's sometimes way too long for therapy, I think.
Of course.
And I FaceTimed her from the waiting room yesterday. And I said to her, I think I'm having a panic attack. Can you talk me down? And she was like, no, you have anxiety and it's perfectly normal, which was maybe semantic, but it felt very different. Like, of course I'm having anxiety.
I just was trying to bring the reality of the fact that you may be a clinician, but you're experiencing this in a whole different way.
I feel incredibly lucky that medicine has got us to this point, that there is a treatment for me. I think back on my time working with Doctors Without Borders in Malawi. It was a cervical cancer project. A lot of them died of a disease that there was no need to die of. They just didn't have the right treatment. And I worked with a patient once. So there's definitely a tendency of like seeing the chemo as poison and the devil, and I'm poisoning my body. And she had a very different approach to this. She was like, every time I get my chemo, I see this as healing. It's like, this is kind of like, she said, rather than poison coming in my body, it's this healing light. And I focus on that. And it's a little Pollyanna-ish, but I do like it. And, one day I really want to write a book on the language we use around cancer because it's very violent.
Oh, absolutely.
We're survivors and we're battling and it's a war and
You're a warrior.
Yeah, it's very violent.
Yeah.
And
from the beginning, I have not been able to see this as a battle. I've had people say to me, fight, fight, fight. And I'm just like, no, I am going to embrace my body and I am going to meld into it and visualize the bad going out and the good coming in. And I feel like there's a Wonder Woman aspect. I just don't feel like there's like, tribal war.
No, I agree. It's yeah. And there's a way that, we were talking, I think before we started recording, about how the Amazon algorithm has been pushing me to buy a fake fur duvet cover, which I think it's such a lovely idea. And as Kristen said, yeah, I'll sweat myself to death. But, there's a way that I really want to take care of my body through this. And honestly, and I hope the oncologists aren't listening, but if I want a burger and a glass of wine, I'm going to have one.
Do it.
It's like, and they definitely said no alcohol. And I was like, I get you. Yeah. Actually, it's interesting. So you asked me a question about logistics and we got into a chat about sort of other things, but I think talking about this long day coming up tomorrow and, lots of friends are offering to come with me. And I'm curious, Kristen, if you had friends come with you and if that was helpful, because my gut feeling right now is I actually don't want somebody there for the 7 or 8 hours. I don't want to feel like I have to be talking to them. And that's my codependent self. So it's
Oh,
like,
sure. Got you. I think we had a little bit of a conversation also about both of us living alone and whether or not we could weather this on our own or do we need to stay with somebody. And so you have to realize I was diagnosed a month before the vaccine came out for COVID. And so they didn't allow anybody in. Nobody could even come upstairs with me while I checked in. So I don't have the perspective of actually saying no. I was being told no. And so, with that said, there were times I wanted someone to hold my hand and tell me it was okay, but it couldn't be someone I felt an obligation to talk with. And I, as a teacher, as a caregiver like you, my tendency is to make other people feel comfortable. And that's not your job.
right. And one of my big defense mechanisms is humor. And so I don't want to feel like I need to entertain somebody while I'm getting chemo.
Totally agree.
Yeah, I was talking to somebody this morning who had this sort of interesting perspective. Is like, some people, when they have pain, whichever pain it may be, physical pain, emotional pain, turn towards people, and some people turn away. And I acknowledge that I'm a turnawayer. And so I'm really relying on my support network to turn my face back towards them. There's lots of people who want to do things to help. If I wanted a ride, I'm actually going for my wig fitting this afternoon, and it's a 45-minute drive, and a friend's coming to take me. But yeah, it'll be interesting together for me to be able to track that process and see. Like I was saying a little bit earlier, like my fear is that I'll go to bed for the next 4 months. From talking to you, Kristen, and the oncologist, it's like that's not going to help me through this process. I have wondered about actually borrowing a friend's dog for the next few months because that's going to get me out of bed.
I think that's a really, really good idea because I have a dog. But see how you feel.
Yeah.
Maybe you have a friend come up and meet you at the end.
Mm-hmm. Well, they do need me to have a ride home.
Yeah, so maybe they can let somebody come in maybe the last hour or something like that.
Oh, I like that idea. Yeah, so they're not committing to the whole time.
I have kind of a darker question about the decision making pattern that I brought up earlier, that it seems like there's a lot of decisions you're having to make on your own, that you are equipped for them because of your job. But Kristen wasn't equipped the way that you are to make some of these really big medical decisions.
Mm-hmm.
What I want to ask you, just sort of from your seat as a nurse, is are the providers who defer the decision back to the patient doing that because they want to abdicate the ownership of the decision for a reason that we don't want to acknowledge, which might be if something goes wrong, they don't want the patient to come back and say, but you told me to do it this way?
I don't think so. That's not what I've seen. I think it's more this sort of move in medicine for it not to be so paternalistic and being told what to do, and more of this. I hear it in San Francisco all the time, this sort of joint decision making. But I think the secret is if you find yourself in that situation, turn it right back to your oncologist and say, if I was your sister, what would you recommend? And that's when you'll get not the truth, but you'll cut through you trying to decide whether you want Taxol or Taxotere. Unless you're an oncologist, how are you supposed to know which you want? It's silly. And it's such a stressful time that I do feel like having people make these decisions is a little unfair. It's like their minds are reeling with the diagnosis and now they're trying to decide, do you want a clinical trial? Do you want a port? It's like, no, please just tell us. Tell us the best thing to do.
What choice would we have other than to go on the internet and go deep into rabbit holes where we're probably not getting the best information?
Yeah. Yeah.
Okay, so you're going to do the cold cap.
Mm-hmm.
And what is that? Can you explain that to people who don't really understand what that is?
So I can maybe give you more information when I've actually gone through it.
Sure.
But I've experienced with the penguin caps that seems, so there's two brands from my understanding, penguin caps and Digny caps. I think it's called something like that. And the penguin caps, you're very much on your own. You have to bring a friend. You stick basically ice packs on your head with like a footballer's helmet or something to keep it stuck on your head. And the idea is that it just kind of, it constricts the circulation to the follicles, and therefore the theory is that you don't get as much chemo to the follicles, and you can keep your hair will still thin, but they said that with the caps, like 85% of people keep 80 something percent of their hair. The new one, the Digny caps, sounds a lot more involved. It's a lot more expensive. Again, thank you, Neil Curry, for this. But they're quoting me a couple of $1,000s for 6 sessions. But one of the nice things of being in a big academic medical center, they have the reps on site. You don't have to have somebody help you. They actually take care of it all.
I love that.
Yeah. And I'm not sure. I'll let you guys know. I mean, they've told me people get a bad headache from it. Definitely like take some ibuprofen before you go. But I don't know. I'll take some pictures and report back. I'm not sure. Yeah.
So the penguin is like wearing an ice pack on your head, like actual ice. But this is actually a rolling machine.
That's my understanding. It's, yeah, like.
And then there's a helmet. I just looked it up because I needed to figure it out. And so, yeah, it looks like a bike helmet kind of. And it must keep your head continuously cold while you're sitting there, which is why it's adding the time.
Yeah. And it could be awful. I mean, I've basically committed to one treatment at a time. I think women's relationship with their hair is interesting. And a couple of friends have accused me of vanity for like, oh, you're so entitled, you can pay the money because you're so, and you guys can see me like, I don't have beautiful long hair. I have like a chronic bed head. So we'll see how it goes.
Well, the trial here, it comes back. Mine came back.
Yeah.
So, and I had the full AC and, all of that, but do what you need to do. Vanity schmanity.
Yeah, no, exactly.
So what kind of comfort items are you going to treat yourself with when you get home tomorrow?
Oh, I think I've bought everything on Amazon recently. I mean, they don't have as much left in their warehouse.
That's why they're building new warehouses all the time, is Natasha.
Yeah. No, I've bought some nice pajamas. The fridge is full of coconut water because I think that's my go-to for hydration. I also really like it. I just started one of those meal services. So, a Blue Apron type thing to get some food in me. Yeah, I'm not sure.
Cozy blankets.
Yeah. Nice cat.
Yes, there you go.
Kind of started dating.
Oh, yeah, that's right. We got to talk about that one. Stay tuned for the podcast spinoff of Dating During Cancer of Natasha and Kristen.
Oh, Lord. Okay, so chemo day 1. It's tomorrow. And then when will we see you again for an update?
Whenever you think will be good.
Yeah, I was thinking like somewhere around 2 weeks after.
Yeah, that sounds great.
That sounds perfect.
Yeah.
Thank you for listening to Breast Cancer Stories. To continue telling this story and helping others, we need your help. All podcasts require resources, and we have a team of people who produce it. There's costs involved, and it takes time.
If you believe in what we're doing and have the means to support the show, you can make a one-time donation, or you can set up a recurring donation in any amount through the PayPal link on our website at breastcancerstoriespodcast.com/donate.
To get the key takeaways from each episode, links to anything we've talked about, and promo codes or giveaways from our partners, sign up for our email newsletter.
You'll get notes and thoughts from me related to each episode and links to the most useful resources for all the breast cancer things. So if you have chemo brain, you'll be able to just go read your email, find anything we talked about on the podcast without having to remember it.
The link to sign up is in your show notes and on the newsletter page at breastcancerstoriespodcast.com.
We promise not to annoy you with too many emails.
Thanks for listening to Breast Cancer Stories. If you're facing a breast cancer diagnosis and you want to tell your story on the podcast, send an email to hello@theaxis.io. I'm Eva Shea, your host and executive producer. Production support for the show comes from Mary Ellen Clarkson, and our engineer is Daniel Cruiser. Breast Cancer Stories is a production of The Axis, THEAXIS.io.